Hi, this video is about my experience with hip resurfacing done on my right hip by surgeon Thomas Gross of the Midland Orthopaedics and Neurosurgery in South Carolina. My hope is that the information provided in this video will give you an example of what to expect if you're undergoing a hip resurfacing. And at the time of this recording, I had my surgery about 1 week ago on Wednesday, June 16th, 2021. Today is Wednesday, June 23rd. So it's been a week. So far, so good. So first off, start up a little bit about me. I'm 42 years old from Michigan and consider myself a pretty healthy patient. Prior to surgery, I wasn't on any medications and don't really have any other complications. So kind of my symptoms and the reason I got the surgery, I would used to play soccer once a week, pretty typically indoor soccer, and after soccer I would have hip pain in the front of my groin in the hip, and I would limp for about 1 to 3 days and have pain. I would take Advil. If I took Advil prior to playing soccer, that would reduce the amount of pain I would have afterwards. And then even without playing sports, I'd also have a slight limp while walking or kind of turn my foot out in a certain way. Also lost some range of motion in the right leg. So if I laid down on my back and tried to pull my knee into my chest, I couldn't get it as far as my left leg. It would basically the leg would externally rotate when I brought it about to 90 degrees. And then just prior to having surgery, I would say that it was getting difficult to tie my right shoe because I would have to bring my leg up kind of sideways to tie my shoe. So as far as getting diagnosed, it was about 3 years ago. I went to a sports medicine doctor, was diagnosed with FAI, which is femoral acetabular impingement, and was told I would eventually at some point need a hip replacement. And so started doing some research and also through kind of a Sirius XM Dr. Radio sports medicine program. I had heard of hip resurfacing and looked into that and found out it's a possibility for someone like me who's young and still active to get a hip replacement that would allow me to continue to play sports, or I should say hip resurfacing, as compared to a hip replacement where those you're supposed to be less active on afterwards. But with the hip resurfacing, the idea is to eventually return to sports. So there is a hip resurfacing surgeon in Michigan that I went to and got evaluated. But in the end, I chose to travel to see Dr. Gross in South Carolina for a few reasons. One was the volume of cases he takes on yearly and how long he's been doing resurfacing. He also does cementless hip device. So when the device the cap goes onto the femur, normally with hip resurfacings, those on the hip side are use some kind of cement in there to attach, and that can be a failure mode, which I was concerned about. And the cementless ones, the idea is they have a porous surface which the bone can grow into, so I was interested in getting that. He also uses an X-ray technique for the socket side, the acetabular, the acetabular piece or component, and he uses an X-ray technique for placing that at the right angle. And my understanding is that is supposed to reduce the chance of kind of getting metallic shavings due to the edges kind of rubbing together of the component. And then also the approach he took was different than the Michigan doctor. He cut through different muscles than the other surgeon, and I felt more comfortable with those muscles being cut through, and I think his approach is the de facto standard approach for this surgery in terms of where you enter, either from the side or posteriorly. Also, he publishes his results and many things, lots of information on his website, which made me a little bit more comfortable. And finally, prior to going to South Carolina, I had a phone consultation with him where he talked me through everything, through all my questions, and answered everything for me. If you do go with Dr. Gross, I'd recommend first going through his website, and he's got a wealth of information on there which you can go through, and also there are some YouTube videos you can access with which go through a lot of the information on the surgery. So the rest of the video is going to be my experience. Everybody's experience is different, but the idea is I'll give you my experience, and hopefully that will give you an idea of what to expect for yourself. So we drove from, my wife and I, Amanda, which is shown here, we drove from Michigan to South Carolina over 2 days. We had some relatives that lived in southern Ohio, which is kind of like 1/3 of the route, and so we stopped there, and it was nice to be able to get to see them. They made us a great dinner, so thank you to the Wolf family for letting us stop over there. And we arrived in South Carolina Monday night, checked into our hotel, which was a Residence Inn, and you can see that here, the nice pool. The Residence Inn was was arranged by Midland Orthopaedics because they have the nurse stop there afterwards, and as well as the doctor. So because I would be recovering there, our room was on the first floor. So when we got there, we stopped by the local Kroger and loaded up our fridge for the week with food, snacks, drinks, all that. So we'd be good to go. So on Tuesday, that was the pre-op appointment, and that's the first thing they do there is the DEXA scan, and the DEXA scan is a bone density scan which allows them to decide how fast or slow you can go on the recovery, and it also helps them decide whether to prescribe you a bone supplement or not. Let me see if I can, here's a example of kind of like what the report looks like. And for me, my score was negative 0.3, which meant that I could still do the fast recovery program. But since my bone density score was negative, the recommendation was to take Fosamax and do their bone health program, which is intended to reduce the likelihood of a femoral neck fracture after surgery, which is it's an already very low occurrence rate, but by doing their bone health program, which includes Fosamax, they claim it goes down to an even lower percentage. I think the original percentage is something like 1%, and with the Fosamax, it's 0 point something percent. So aside from the DEXA scan, I also got x-rays done, And after that, I got to meet and talk with nurse practitioner and Dr. Gross about the surgery and get any final questions answered. And they also went over the medication plan at this point. What time you take things, what you're taking, what they're for. I'll cover some of that a little bit later. And then after I met with Dr. Gross and the nurse practitioner, that's when I got to pick up my ice machine, which is shown here, and pick up my crutches, as well as the hip kit. So the hip kit they give you just has some useful tools, like a grabber. I think I got one here I can show you. And this all came as one kit. You got your little grabber tool, which is picking up stuff, as well as helping you put on your pants. Grab the pant leg at the bottom, since you won't be able to bend down after surgery. And this one right here is kind of the leg grabber. It's kind of like a stiff arm that's got a loop at the bottom. I can put my foot in the bottom of the loop and lift my leg up. And that one was one of the most valuable tools after surgery, just because lifting your leg up every time you sit down, you either have to do it with the leg lifting tool or have somebody come do it for you. With the leg lifting tool, it's nice because you're the one, as you scooch back, you're adjusting your leg and you know when it's going to move, and so you can kind of avoid pain that way. So I thought that was worth it. It also included a tool for putting on your socks, a little scrub brush on a stick, things like that. Oh, a shoehorn, which I haven't used yet. So, but also the leg lifter, I'd say, for getting in and out of the car, that one it's one of those ones you want to keep on hand. So the ice machine and the crutches are the things that you have to bring to the surgery center with you after, or bring with you the morning of surgeries, because they're going to fill it with ice for you, teach you how to use it, and then also you're going to be using your crutches right after you're done with surgery. So then the only other thing on this day, one of their recommendations was to drink lots of fluids and stay well hydrated. So we stopped one more time at Kroger and picked up some sports drinks and just extra water, and I kept hydrated the rest of that day. So the rest of the day after the pre-op appointment, you're pretty much free, and you can enjoy the day. So we went back to the hotel, did some reading, enjoyed the pool, and then in the evening for dinner, we got to head downtown to a restaurant called Cantina 76, and we enjoyed some tacos, and it was kind of like a little outdoor patio area, so that was pretty nice. And that was actually right near where the surgery center was downtown. So, for the night before the surgery, the main things they want you to remember is no eating or drinking past midnight, and then they want you to wash the surgery site with the special cleanser that they give you at the pre-op appointment. And you do that the night of, and then also the morning of, right before you head to the surgery center. Day of surgery. So it was an early morning, and we had to arrive at the surgery center at 6:30 a.m. and it was going to be a hot day in Columbia, but it was perfect out at 6 in the morning when we went outside. The temperature was really nice. So 6:30 a.m. we arrived at the surgery center, and at 8:30 was when the surgery was supposed to start. And I was actually Dr. Gross's second surgery for the day, starting at 8:30. So when I arrived, they had me drink an orange drink juice box, and that was supposedly to make it easier for them to start the IV and draw some blood. And pretty soon after I got checked in and filled out some paperwork, they took me back. I said goodbye to Amanda, and I headed back to kind of the holding area. There, they just had me go to the bathroom. Then I signed some forms, and then took a bunch of pills that they explained each one to me. And several of them are ones that I will continue taking immediately after, which I'll go over later. And then got undressed and into their hospital gown and cap, and you can see me there with that on. Next, they took some blood and got my IV started. Thankfully, they only had to do one poke for both. It took them a little while to get the blood flowing. They take the blood because they spin it down and inject it into the joint later, I believe, to that the plasma that they take that is supposed to help the healing process. So I got hooked up to the IV. The nurse practitioner stopped by, just wanted to see if I had any questions. You know, they have me sign my right leg with the word yes. The nurse practitioner signs the leg. The anesthesiologist signs the leg, make sure they're all working on the right leg. The anesthesiologist stopped by to explain what they were going to do, and he, you know, I wasn't put on general anesthesia. It was basically a blocker plus some meds to knock me out, but I would be, during the surgery, breathing on my own, so no breathing tube or anything like that, and no catheter, so both those were nice. Once I was on the meds, that's kind of the last thing, you know, once they injected it into the IV, that's the last thing I remember until waking up in the recovery room. And so the surgery took less than 2 hours. They brought my wife back after I woke up, which was around 11:30. I felt pretty good when I woke up. I didn't have any pain. Didn't really feel too much different. They gave me some crackers to start, and they kind of started talking to us about medications. And then once I was ready to eat, which wasn't too long, they provided lunches for both me and Amanda. And while we were eating, they were giving Amanda a rundown of, you know, medications, follow-up things to do back at the hotel, just because, you know, they weren't sure if I would remember everything telling me, obviously. So after that was done, and once I was mostly ready, I was still a little bit sleepy, they started giving me instructions on things like leg restrictions. You know, don't move your leg past 90 degrees, no leg crossing, no internal rotation. They talked about how I would use the crutch, talking about getting off the bed, getting back onto the bed, never lay down on the floor, those kind of things. And then also talked me through crutch usage on going up and down stairways and different scenarios. And so after that was done, it was time to get up and get out of bed and take a practice lap around the surgery center. So I got out of bed with the crutches, okay, and, you know, took very slow steps across the surgery center with people behind me, beside me, and ready to catch me if anything bad happened. And made it over to their practice stairway, which just has like 2 stairs up, 2 stairs down. And stairs are definitely the hardest thing to remember. You kind of have to remember that you go up with the crutch first, or you, yeah, actually that's wrong. You go up with the good leg first, followed by the bad leg and the crutch, and you go down with the crutch first, and then the bad leg, and then the good leg. But after you think about it and do a few practices, it starts to click and make sense what to do, and it hurts if you do it wrong. So So after the practice lap was done, then it was time to head back to the hotel. They gave us all our documents, medications. They gave us a little picture of the post-op x-rays, which you can see there with the component in it that looks kind of like a popsicle. And they wheeled me out to the curb. Banda went and got the car, and we were all set to head back to the hotel. And this is getting into the car is a little bit of ordeal. We got to put the seat all the way back and kind of get in with the good leg and then swing in the bad leg. But I started getting the hang of that as well. Going back to the hotel went well. Again, I was pretty slow at first on the crutches, and they want you to be slow. They want you to do slow turns, slow movements. The idea is don't fall, get used to it. And I still had no pain this entire evening, so it was really good. I mean, I could tell if I were to move my leg quickly that I would have pain, but obviously not doing that. But any kind of sudden movements would cause a little bit of pain. You can see all the medications on the counter there. Amanda kept all my medications and the timing of taking them straight. And so I'll give you a quick rundown of what I was on here. First one is an NSAID I was on called Mobic or Meloxicam, an NSAID to prevent swelling and also prevent formation of bone into the muscle. Then I was on a proton pump inhibitor called pantoprazole or Protonix, which is to prevent reflux and to prevent GI bleeding while taking a blood thinner. And so I was also on a blood thinner. Mine was called Xarelto, and it's to prevent clots. And then I was on Movantik for constipation, which did occur for me, and I'll talk a bit about that later. I would recommend probably good idea to start right away on a stool softener or something like that. I did start taking one, I think the next day, but we didn't have it immediately. And they provided Zofran, which I did end up taking, which it's just something that is needed if you have any nausea or vomiting. And then finally the narcotics, MS-Contin and oxycodone. One of them's a long-acting and one of them's a short-acting pain medication. And these can be weaned off if you don't have pain. I chose to wean off them once I got back home just because I didn't want to encounter pain on the road trip home. Also that evening, a nurse visited us at the hotel just to check in on us and see if there were any problems. And that went well. So then this is, I back up one slide. You can see me in the picture there kind of moving around on the crutches. There wasn't a whole lot of problems getting around on the crutches in the hotel room. And they don't want you doing exercise, for the first week on the crutches. So it's mainly just to get around, right? Like move from the bed to the sofa and get to the restroom, which I went to the restroom plenty of times. So that was getting me up quite a bit. That night at the hotel went well, and I didn't have any pain that night. After surgery, I was keeping well hydrated and drinking a lot, so I had to get up multiple times to go pee in the night. And really, the whole time I was there after surgery, going pee what felt like quite a bit. And so, getting in and out of bed is a process because getting that leg up onto the bed is difficult and everything is slow. But, thankfully Amanda was willing to get up each time in the night and help me out. You definitely need someone willing to accompany you on this trip who's willing and able to help out with pretty much everything after the surgery, because you'll be asking him to get things for you, put your leg up on the bed, help you get your leg down off the bed, Every time you got to go to the bathroom, you got to have somebody follow you, make sure you're not going to fall, those kind of things. But this picture here is showing me on Thursday morning starting my twice a day exercises. There's only 3 short exercises, and they were somewhat there. One of them was somewhat hard to do at first. They're not very difficult. You can see the one there that's the easiest one I'm showing here is the leg raises with something under your pillow. The second hardest one was you kind of tense your leg up and squeeze your buttocks, make a straight leg. And then the hardest one for me starting out was where you bend at the knee, and your leg comes. You don't go to 90 degrees. You go to less than 45 degrees. But really, just starting that leg moving, the initial start was the hardest. Once it got a little bit off, the knee got a little bit bent, then it was easier to move, and that got easier each time as it went along. Dr. Gross stopped by some time in this morning to check on me and answer questions. He cleared us to leave. He checked on the. He just asked questions and checked me over. Oh, one thing I forgot to mention was is the where the incision was made. They put a bandage over it, and there was also an incision made where they had attached a tool to measure the leg length. Let me see if I can bring that up here. Yeah, bring that over here. So this is the incision right here. You can see there's a little bit of bruising, and this bandage is like an adhesive bandage that won't come off for the first week. I actually still have it on. I can take it off anytime between like now and 10 days, and you can wash with this on, take a shower with it on, no problem. This is where they inserted the leg measuring pin, so they can measure how long the leg is before and after surgery. So the rest of that day, I just took it easy, iced the hip on and off for 1 hour on. You ice it, and 1 hour you take a break from icing, and the icing is definitely something that helps. I think you can see in the picture over here, I've got a breathing machine that they give you to incentive breathing machine where you blow into it just to exercise your lungs, and I use that every so often as well. So then that evening, Thursday, after I had dinner, I really started feeling like overfull and like having some acid reflux almost, and just feeling like I was too full, kind of bloated, and I had not yet had a bowel movement at this point. And I did start taking some stool softener, which is pictured there, and probably I'd recommend maybe taking it earlier. So while I've not yet had any pain from the hip, this was the first time I started feeling a bit uncomfortable. But thankfully, the next morning, I was able to go to the bathroom and go number 2, feel quite a bit of relief from that before heading out on the road. So on Friday, that's when we checked out of the hotel and we started the drive home. Amanda had to load up the whole car by herself because I couldn't help, and she had to do all the driving. So for me, the drive wasn't bad. I never really felt sick. We drove in 1 or 2 hour increments and stopped at rest stops and gas stations, go to the bathroom, stretch out, as well as get Amanda some coffee to keep her going. And then we again stopped at my relatives. Once again, thanks for them. They made us some delicious breakfast. It was nice to get a driving break. And then we started on the next morning, Saturday, we got back home. And once I was back home, started weaning off the narcotics. And once I was off the narcotics, I did start having some more soreness and kind of dull aches. in the hip, not bad. I wouldn't say like sharp pain, but I could feel my incision more. I could feel, especially in the mornings, just felt sore and like inflamed. And right now, whenever I get up in the morning, that first icing session is what seems to really fix that. So get up, get the ice on, and that makes it feel a lot better. And now that I'm 1 week out, I'm moving a lot more easily with the crutches. I can do, and I do this with the crutches. I just do the one crutch on the side opposite the bad foot, and that seems to be just fine now that I've got better balance and more practice with the crutches. And I'm also cleared to start walking about a quarter mile, which I haven't done yet, but plan on doing after this video. In the picture that I show here, I was visited by a relative who recently had a femur fracture and had plates and screws put in, and he's on a walker. So it was nice that he stopped by. We got to compare walkers and crutches and life with one bad leg, and so that was nice to see him. So that's it. I still have plenty of recovery left ahead of me. 6 weeks is kind of the time frame when most of the walking and movement restrictions are lifted, and kind of work my way up to one mile walking by 6 weeks, and then 6 months is the kind of the target time frame for when I can start being more active with sports. So I'll hope to give you future updates, and I'll also post in the channel a few additional videos that we took during our trip. Thanks.